Hi, I'm Carl Bradley. I'm an extension plant pathologist with the University of Kentucky. I'm based out of the UK REC in Princeton. I'm going to talk about sudden death syndrome today. I'm standing next to some soybeans out in a field, and maybe you can see all the symptoms that we're starting to see here. For sudden death syndrome, what you're normally going to see are the symptoms that occur above ground. So, just for instance, what you're first going to see when symptoms are starting to show up is some flecking, some yellow flecking that will occur on the leaves. Eventually those flecks will turn a little bit bigger, and you'll have some necrotic or some dead areas in there as well. One thing to note is all those symptoms on those leaves, those are always going to be interveinal, so they're going to be between the main veins on the soybean leaf. And you can see some here that were really affected and how the veins remain green. Eventually those leaves will fall off, but the petioles will remain. So you'll just have plants out here that will just be petioles and the leaves will have fallen off. And so that's why this is kind of an important problem, because of the yield loss that can occur because of the leaf loss and the loss of photosynthetic active area on the soybean plant. So this disease is caused by a fungus known as Fusarium virguliforme. Infection actually takes place very early, even though we don't see these symptoms until later in the season. Once plants start to go through the reproductive stages, once they start to flower, and especially when they start putting pods on, that's when we're more likely to see these above ground symptoms, even though the fungus infected these plants months ago. So the fungus is soil-borne, it lives in the soil. It will start to infect those plants and affect the roots once those seeds begin to germinate. So this will occur very early in the season. There's a higher risk for disease when we're planting into very cool conditions. So some of those early planted soybeans, like early April, it's going to be a higher risk for sudden death syndrome in those fields because of the cooler soils, slower plant growth during that time, but this fungus is able to cause an infection. So what you're seeing here from these symptoms, that's actually because of a toxin that the fungus produces. The fungus actually remains down in the root area this entire time, but it produces a toxin that's translocated up through the plant and causes these symptoms. So if you dig roots up, and then take your knife and start to kind of shave away down in that root area, you might find that some of this pith area is really dark down here in the root zone. That's also indicative of sudden death syndrome. There's another disease called southern stem canker that causes very similar foliar symptoms, where you have the interveinal chlorosis and necrosis. For southern stem canker, you will see lesions or dark spots on the outside of the stem. For sudden death syndrome, you will not see any kind of lesions or anything on the stem. So another risk factor for sudden death syndrome is the presence of soybean cyst nematode. We have found that there is an interaction. When you have soybean cyst nematode present in your field, you're going to have a higher risk for sudden death syndrome as well. You don't have to have soybean cyst nematode for SDS to be present, but if you do, the risk is elevated. In regards to management of this disease, the first step is to grow varieties that have a high level of resistance. This disease has been in Kentucky since the early 1980s at least. So breeders have had an opportunity to breed for highly resistant varieties. So we are fortunate in that maturity groups that we grow here in Kentucky, it's pretty easy to find varieties with a high level of resistance. More recently, there's been a couple of new seed treatments that also have efficacy against sudden death syndrome. So that's also another option. You can go to the Crop Protection Network. It's just cropprotectionnetwork.org, where we have a seed treatment fungicide efficacy guide, and you can go through that and you can pick out the seed treatments that have efficacy against sudden death syndrome.